Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hello, everyone, and welcome back to another episode of the Friendly Pharmacist podcast. I'm your host, Nario Cantu, and today we're diving into a topic that sparks a lot of curiosity, debate, and sometimes even confusion: herbal and alternative medicine. Over the years in pharmacy practice, I've seen a growing interest in natural remedies, supplements, and therapies outside of the traditional prescription world. Patients often come to me with questions like, is turmeric safe for my arthritis? Or can I take echinacea to prevent colds while I'm on my blood pressure medication? These are really important questions, and they highlight why conversations around herbal and alternative medicine are so necessary. So today I want to walk you through the benefits, the risks, and especially the interactions that can come up when herbal and alternative treatments are combined with conventional medications. By the end of this episode, my hope is that you'll feel more confident talking about these therapies with your healthcare providers, or, if you're a fellow pharmacist or clinician listening in, you'll have a framework for guiding patients who are interested in this space. Let's start with the why. Why are so many people drawn to herbal and alternative therapies? First, there's the idea of natural equals safe. Patients sometimes believe that if something comes from a plant or is labeled as herbal, it must be gentler or healthier than a pill made in a lab. Second, cultural traditions play a huge role. Herbal medicine has been part of human history for thousands of years. From Ayurveda in India to traditional Chinese medicine, to Native American herbal knowledge. And third, there's accessibility. Many supplements are available over the counter without a prescription, which can make them feel more approachable. And to be fair, many herbal products do have real benefits. For example, turmeric has anti-inflammatory properties and may help with joint pain. Echinacea is often used for immune support during cold and flu season. Ginkgo biloba has been studied for memory and circulation. St. John's wort is one of the most widely researched herbs for mild depression. So there's definitely potential here, and in some cases, good evidence. But let's look at the other side of the coin. Natural doesn't always mean safe. Hemlock is natural. Poison ivy is natural. What matters is how a substance interacts with the body. Some key risks include lack of standardization. Unlike prescription medications, which go through rigorous FDA approval, supplements are not always tested for purity, strength, or consistency. One brand of valerian root might contain very different amounts of active ingredients compared to another brand. Side effects. Herbal products can and do cause side effects. For example, kava, an herb sometimes used for anxiety, has been linked to serious liver toxicity, false sense of security. Some patients may delay getting proper medical treatment because they're relying solely on herbal remedies. For example, someone with uncontrolled high blood pressure might try hibiscus tea or garlic supplements instead of proven medications, and that can be dangerous. Now, let's talk about what I consider the biggest concern in pharmacy practice: interactions between herbal supplements and prescription medications. This is where things can get tricky and where pharmacists really shine as medication experts. Let me give you a few important examples. St. John's wort can speed up the metabolism of many medications by activating liver enzymes. That means it can reduce the effectiveness of antidepressants, birth control pills, blood thinners, even anti-rejection medications for transplant patients. Ginkgo biloba can thin the blood, so if someone is already on warfarin or aspirin, it can increase the risk of bleeding. Kava or valerian can cause sedation. Combine those with alcohol or with prescription sedatives like benzodiazepines, and you may end up with dangerously increased drowsiness. Garlic supplements, great in food, but in concentrated pill form, they can also increase bleeding risk if taken with anticoagulants. And here's the kicker. Many patients don't even think to mention their supplements when you ask them what medications they're taking. They'll say, "Oh, I'm not on anything," while leaving out the handful of vitamins, herbal teas, and capsules they take every morning. So what can we do? As pharmacists, doctors, nurses, dietitians, we need to create an open, judgment-free space for patients to share what they're taking. Instead of dismissing herbal therapies outright, we should ask, listen, and then guide. I always tell patients, bring me everything you're taking, even the stuff you bought at the health food store. Let's look at it together. That way we can check for interactions, review the evidence, and make sure nothing interferes with their health goals. I also recommend patients look for supplements that have been verified by independent organizations like USP Verified or Consumer Lab, which test for purity and accuracy in labeling. It's not perfect, but it's better than flying blind. At the end of the day, I don't see herbal and conventional medicine as enemies. They can complement each other beautifully when used wisely. For example, ginger for mild nausea during chemotherapy can be a nice add-on to prescribed anti-nausea medications. Or melatonin for occasional insomnia can sometimes help people transition off stronger sleep aids. The key word is integration, finding safe, effective ways to blend traditional and modern medicine for the benefit of the patient. So if you're a patient listening to this, my advice is simple. Be transparent with your healthcare team. Don't be afraid to say, "I'm taking turmeric capsules," or "I've been using ginseng tea every day." Your pharmacist isn't there to judge. They're there to make sure you're safe. And if you're a healthcare provider, my challenge to you is this. Learn enough about herbal medicine to have meaningful conversations. You don't need to know everything, but knowing the most common supplements and their major interactions goes a long way in building trust and guiding safe choices. And that's all for today's episode of the Friendly Pharmacist podcast. I hope this conversation gave you a balanced perspective on the use of herbal and alternative therapies. They're not miracle cures, but they're also not nonsense. With the right knowledge, they can be part of a safe, thoughtful health plan. Thank you for listening. And if you found this episode helpful, please share it with a friend, leave a review, and subscribe so you don't miss future episodes. Until next time, this is your friendly pharmacist reminding you, stay informed, stay healthy, and always stay friendly.